Hi everybody, my name is Kaylee, and today that we're going to be talking about dermatitis. I know, so exciting, and it is categorized as a systems disorder. So the first slide talks about the medical definition of dermatitis, and it says dermatitis is a general term for a variety of skin conditions that cause inflammation, irritation, and rashes. Okay, so how dermatitis is developed. So before I get into that, the system that is involved is the integumentary system, is because the skin is the largest organ in the whole body. So that is why it's a part of that system. And factors associated with the development of dermatitis would be, health, family history. If you had some family with it, then you're more likely to get it with people who don't have family who has it, who has dermatitis, and maybe eczema, allergies, or maybe even asthma. And the next thing that can affect it is the environment. Certain irritants like soap, chemicals, detergent, or maybe even allergies like pollen or dust or pet dander. And then the immune system is also kind of affected with this because an overactive immune system responses to external stimuli leading to inflammation. And also lifestyle factors will kind of make you have dermatitis flare-ups or something like that, and stress and your diet can do that for you. Now, there's a good bit of symptoms if you have dermatitis that you could have. Not saying you have all of them, but there is a few of them. You could have itch, it could be itchy, or it could be red and have a rash, or your skin could become really, really dry. It could swell and cause blisters and cause your skin to thick up, and a crust may form around it, and actually the color of your skin around the dermatitis, not the infected area, but around it, could become like lighter or darker. There's a few steps to how you diagnose dermatitis. And the first thing is you're going to talk with your doctor, and your doctor is going to ask you about the symptoms that you may have, like how long you've had it, anything that like triggers it that you know of, and your family history to kind of see if that's what it is or maybe something else. And he'll check for itching and redness and rash and the other type of symptoms that we've discussed earlier in the previous slide. And they'll do like a patch test where they take a little sample and see if that's what it is or not, and go and test it. They'll do a skinopsy, only in some cases, skin biopsy, but only in some cases though. They'll take a little small sample of skin and have it examined under a microscope. And also in a few cases they'll do a blood test. And also allergies, because your allergies can also flare it up. And positive results indicate sensitivity to specific allergens, providing clues to help you manage your symptoms of dermatitis. Like we discussed earlier, the organ systems involved, and one of them is the integumentary system. That's kind of like the main one. And it says the system includes the hair, the skin, and the nails. So it's not just your skin. But the dermatitis primarily affects the skin. And this can lead to the disruption of the skin's barrier function, making it more likely to have infections or dryness or irritation. And this also affects the immune system, and the immune system plays a critical role in dermatitis. And particularly in the atopic dermatitis and the contact dermatitis, where the abnormal immune response to allergens or irritants occurs. So there might be something different that your body does to try and stop it. Alright? And the impact in dermatitis, the immune system can become overactive, leading to inflammations, flare-ups, and all that fun stuff. Have no fear, y'all. There are treatments for dermatitis, and these can include topical treatments and corticosteroid creams. Wow, big word, y'all. I've heard that so many times. And ointments. Moisturizers can help. Sometimes you have oral medications that you can take, like pills and such, and like oral like creams and stuff like that. Phototherapy actually helps. Controlled exposure to ultraviolet light can reduce symptoms of certain types of dermatitis. And also there's like grandma remedies and like lifestyle remedies, which basically is to avoid whatever triggers it. So the benefit of those treatments, so the creams and the ointments, they will reduce inflammation, help with the itching, and provide relief for like the quick, like sudden flare-ups. The moisturizers would help like maintain the moisture in it and help that your skin's natural. You can't see my hand. Help your skin's natural barrier. I don't have dermatitis. I'm just little show and tell. The oral medications can reduce itching and improve your sleep quality, because those flare-ups can be kind of painful sometimes, and it might cause you to not have a lot of sleep. Phototherapy, like I said, can help reduce inflammation and itching, and those little lifestyle home remedies can prevent you from having those flare-ups, from needing the phototherapy and the medication and such. Now let's talk about your quality of life whenever you have these dermatitis and have like the treatments and stuff like that. Because with the appropriate treatment, many patients can achieve good control over their symptoms. This can reduce itching, reduce fewer flare-ups, and have like a good impact on y'all's daily lives. There's also like a psychological impact, because dermatitis can appear on your face, can appear on your arms, and some people are like self-conscious about all that. So helping with the treatments and everything will help like get us down, help take your flare-ups down, and help your self-confidence to go up. And successful management can also reduce anxiety and depression related to like having like to go to somebody and say, hey, like for a job interview, hey, my name is Kaylee, and all you thinking in your brain is that they're staring on this patch of dermatitis on your cheek. And just going to be a few adjustments that the patient or you might have to make, like your lifestyle changes. You might have to avoid a certain type of detergent or a certain type of lotion, but it's all for the greater good. Let's talk about how to prevent and how to avoid these dermatitis and dermatitis flare-ups. So you want to get rid of like the allergies that you may have, or the things that irritate your skin, and be like aware of the weather conditions that are outside. So if it's hot outside, you might want to put a little more moisturizer on it to keep it kind of safe and keep that skin barrier built up. Maybe your skincare routine needs to be adjusted. Say you don't need to use a certain brand, you need to use all clear and free stuff, and get some moisturizer, and lots of moisturizer for not your face, for your whole body or whatever you have it. Using sunscreen can also help your skin and protect it against the sun. Your diet and nutrition may need to change. You might need to be rich in vitamins and nutrients to support your skin health, and things that help you glow and everything might help you also with your little flare-ups. All right. This is kind of simple. This is my works cited page. I hope it is correctly in APA format. And lastly, thank you so much for having a listen to my PowerPoint about dermatitis. I hope that it was very informational and may even help you or somebody that you know. Thank you.